When performing a Pleurx drainage, sometimes things don't always go as planned. While some issues can be dealt with at the bedside with no risk to the patient, others may require you to contact the physician or even call a rapid response. This video will explain how to deal with the more common issues that are seen with the Pleurx system. When you are removing the dressing, you should always see a sterile cap attached to the end of the Pleurx catheter. If you notice that this is not in place after the dressing is removed, you will need to contact the physician. It's possible that the system has become contaminated, and it will need to be assessed by the pulmonologist before it can be used again. If after removing the dressing, the Dacron cuff is visible, you will need to contact the physician. The Dacron cuff should always be under the patient's skin, and if it is visible, it is a sign that the catheter has been pulled out of place. The doctor will need to verify placement before the catheter can be used again. If during your assessment of the catheter you notice that it is cracked, cut, or is leaking, quickly clamp the catheter as close to the patient as possible and call a rapid response. If one is available, you can use the blue emergency clamp provided with the Pleurx drainage kit. If one is not available, you can kink the catheter as if you were kinking a hose to stop flow, or use hemostat clamps to secure the catheter. If the catheter has been damaged in this way, it can allow air, fluid, and bacteria to move freely into and out of the pleural space. This could cause a number of issues, including infection or pneumothorax. A rapid response is necessary to ensure this patient's safety. If the patient complains of discomfort or pain while you are draining the fluid, simply slow down the flow by closing the roller clamp by small increments until the discomfort has subsided. When the patient is comfortable, you can either open the roller clamp again, or you can continue to drain the fluid at a slower rate. There is no required time to complete this drainage. You are always allowed to slow down the flow in order to keep the patient more comfortable. If when you open the roller clamp, you notice that the system is draining slowly or not at all, it could mean that there is not enough fluid in the pleural space to drain, or it could mean that the catheter is in a position that is hindering its ability to drain the fluid. It's possible that the catheter is being pressed up against the chest wall. To dislodge the catheter, you may need to help your patient change positions. If this is effective in dislodging the catheter, you should begin to see fluid drain into the bottle. These are some common issues that you may see while working with the Pleurx system, but they aren't the only problems that may require some intervention. When you have an issue with the system, contact the physician that placed the catheter. This is usually the pulmonologist. Or, if you think the patient is in immediate danger, call a rapid response.